Hi everyone, welcome to my channel. Today my point of discussion is on the mental health. It is how it is connected with the brain and also its maintenance of good mental health during our life. Nowadays all of we are concerned with the mental health because most of the people are educated now from the previous lifestyle. So there is problem arises in the family as well as in the society. So one has got the responsible to cure it. Not only the doctors, the surroundings also helps it. Now, what is mental health? Mental health means you will be well-being in the coming surroundings and you will be ready to recognize everything which people told to you. So that is the cognitive health must be clear. So this is the mental health. Now, sometimes we see this mental health is disturbed. Now, previous idea is that if somebody is disturbed mentally, we give him a stigma that he is a mad person. But this is not so. This is purely a curable thing. This is just like diabetes, hypertension. It is like that. You have to take medicine throughout your life because you see our brain, the brain has got here the frontal lobe. Now where I put my bindi, you will see this region is known as the prefrontal cortex. And this prefrontal cortex is very much responsible for higher thinking, for concentration, for the different cognitive affairs. See, and this part of the brain is related behind. That means where we actually lie down, then the occipital bone touches the pillow. So, in the occipital bone, beneath that there lies part of the brain which is the occipital lobe. This lobe is concerned with our vision. So all of our working, you see, the brain does do work, the vision is an important part. So dominant part of the hemisphere, the hearing, everything is connected with the processing of cognition, the memory formation and all the depression you will see. Now depression is not a normal phenomenon. But what will happen when the surroundings is very bad? The person cannot cope up with the surroundings. Then the secretion of the brain, that is the serotonin, amines, they are decreased in amount. So when this decrease in amount, there is started of mild and moderate depression. Now, if the surroundings, that means the family, they are concerned with that, they go to the doctor. Nowadays, there is very nice medicine that is emerged in the field of treatment. So, they can complete their life and they can go to the high situation. And that means in the top with this disease. That is not so different. Now, what thing the surroundings, that means the family will do? The family will counsel with that patient, then take the patient immediately as far early as possible so that the chance of curation is more. They go to the doctor and don't see this has got no stigma. This is like the diabetes, this is like the general fever, like that, this disease. You don't think that surroundings will be actually, if it knows, then there will be the harm. No harm is there. Particularly I see in the middle class family, they think more than the other two classes. So I think in this way, if there is possible, you counsel yourself within your family. If it is okay, then you counsel with the teachers and the friends with this matter. The matter means depression. Depression means there is no lack of initiation of work, and also you see there is lack of presence of mind. All these things, they keep away from the other family member, sit in a corner, and actually they are confined themselves within a small space. So this is the symptoms. There is no energy. So this is the way the family can counsel. Now when it is recovered, then it is okay. But if the family sees that the person, it will be worsened day by day, then you have to go to the doctor and proper psychiatrist will treat it, and there is no problem of anything in the later period of life. And the guardian should know that the person who is suffering from this depression, don't make him force to do a great job, you do a nice thing, you do a miracle thing so that the patient family will be benefited. So this is all about the depression and the bipolar state. Our main intuition and also the thinking process lies in this part of the forehead, and this part of the brain is known as the frontal lobe. So this is a center. Another thing is the behind this pole is known as the occipital lobe. From here we can see, and the temporal pole we can hear everything. So all these things conglomerate and they give rise to this sensation of well-being, etc. Because the neurotransmitter serotonin is actually secreted in a plenty of amount. But in case of depression, what happens? Either due to some social condition or some failure, there is the decreased secretion of the serotonin and also the MAO inhibitor. In this reason, so how you will or a person can cure the patient? First, immediately you have counsel with the patient and then go to the good psychiatrist. There are lots of good medicines are there, and this phenomenon does not give a stigma to the family or the society. You go there and treat the thing. And another thing, the prevention measure is that if the family or the guardian wants the best from their child, so this gives an added disadvantage to the child and make him or her in a depressed state. So in this way, one can prevent the depression. Thank you everyone for watching this video, and if you like this video, then you can share it to your friends and give me also a thumbs up.